Ahead of the holiday season, Indiana's Department of Health is allowing overwhelmed hospitals to request additional support from the National Guard. Reporter Brock Turner reports teams are currently stationed at more than 20 hospitals, and in some cases, units could be there into the new year.
Hospitals can now request up to 4 weeks of backing, double what was allowed under the previous framework, from National Guard teams that include both clinical and general support. The deployment is made possible through an emergency order from Indiana Governor Eric Holcomb that has been extended nearly 24 times since the pandemic began. However, today's situation is more acute. Hospitalizations surpassed 3,000 this week for the first time in over a year. And the state's ICU bed capacity dipped below 20%, a threshold in the past that has triggered the cancellation of elective procedures. A recent analysis from the Kaiser Family Foundation found only 15% of COVID hospitalizations occurred among those fully vaccinated, with age playing a significant role. Hospitals say workers are overwhelmed after serving on the front lines for nearly 2 years. Those challenges are exacerbated by the labor market for medical professionals, which is increasingly competitive. Since September, the Guard's 6-person teams have visited nearly 36 facilities. Indiana has one of the lowest vaccination rates in the country. Just 54% of eligible Hoosiers are vaccinated. For Indiana News Desk, I'm Brock Turner.
As cases surge in the state, dozens of Hoosiers testified against a bill Thursday at the State House that would weaken employer vaccination requirements. House Bill 1001 would allow employers to require vaccinations but force them to make exceptions for people who recovered from COVID-19 in the last 6 months. It also allows employees to opt out for religious reasons with no further inquiry. Many citizens who testified said if it doesn't ban vaccine requirements, they don't want it. Others said the bill prevents businesses from protecting their workers.
Employers should be able to establish what their working conditions are and their work rules, including vaccination mandates.
Lawmakers don't plan to vote on the legislation now, but have promised to revise and advance it in January.